I think being raised here is a blessing and a curse because there's no energy quite like New York. And no matter where you go, you can love other cities, but nothing like New York's mix of people and New York's vibrance can pull you in quite like the city does. I've been a dermatologist for about 11 years now. We opened this first practice in Front Street in 2007. We started off doing just kids, and I started off as a pediatric dermatologist. And it was so meaningful for me when parents then said, well, wait, I'd like to be treated too. Do you know how to treat adults as well? And that was my primary training. So it was sort of a natural extension that then we started treating families, and then it kind of grew from there.
What attracted me to Dr. Buka's practice in the first place is the fact that he has 7 offices. I've actually never worked at such a medium-sized company before. I did some research my early career. You know, I kind of want to steer my career direction to somewhere that's I would find more fulfillment in. I definitely know that every day I wake up, I want to come to work.
In each location, as we grew, the community was really resonating with what we were doing. We really want to bring dermatology back to the people and make it a lot more accessible.
What we're trying to create is a truly differentiated brand within the market. One from a patient experience perspective that takes the patient from, the staid, white-walled medical offices to an environment that's more comfortable, puts patients at ease. It's designed really to heighten the patient experience.
Dr. Buka really takes care and takes the time to design these facilities that don't make you feel stuffy. It's almost like a coffee shop or like your friend's house.
Amazing service, went beyond my expectations and provided me with a great experience. It was my first time seeing a dermatologist.
Staff is great, extremely very kind, jovial, and
My CO, Jamie, asked me to come up with a mission statement for us. Like, what are we all about? And I immediately thought, well, I know number one, we're making patients feel comfortable in otherwise sometimes tricky situation, right? They're meeting me for the first time. They're getting undressed in front of a complete stranger. They're trusting in our ability to help them with whatever condition they've come in with. Where would you feel most comfortable doing that? Well, I guess in your own house, right? In your living room.
It's not as sterile. The office has a lot of character, all the different personalities. It's the flow. It's funky. We try to have fun, but keep it professional at the same time.
It's a very, very unique practice. I come from a vast experience of various other practices in the New York City area. Cornell, NYU, and Albert Einstein College of Medicine. I was fortunate enough to have trained with some of the best dermatologists in the country. I was very excited and enthusiastic to join Bobby Buka Dermatology because it really is a true vision of what healthcare delivery should be in this country.
A lot of practices are outdated. They remind you of being sick. There's nothing in our offices that remind you of being sick. We don't want that. So I think that Norman Rockwell painting is a really good illustration of what medicine used to mean to people. It was the country doctor who would invite you into his living room, to his hearth, and really work in a holistic fashion, not just with cutaneous medicine, but also sort of the emotional factors, the self-confidence factors that dermatologic conditions can have on people. That's the patient we want to be there for most. And after we understand them and how their disease process is affecting them, then we'll work on the biology of skin and the immunohistochemistry of skin. But really we want to treat people and not conditions.
Working in an environment where everyone gets along as a family, that's projected towards the patients, yes.
I was diagnosed with uterus cancer, and I went through my whole ordeal with good nurses. Coming out of my cancer, I decided to become a medical assistant. I always try to make sure that my patients are comfortable and don't feel like they're in a doctor's office.
I really do like being around the patients. I really like to make sure the patients are comfortable, to make sure that their visits are running smoothly. I really enjoy having patient contact. So that's my favorite part of my job, is interacting with the patients. I love it.
I mean, the goal, I think, of every major medical center, every provider, is to put the patient first. And I think we all kind of sometimes get lost in the midst of different things, and economics and different factors become part of the equation. And I think at Buka Dermatology, the patient comes first. By doing things in a compassionate, caring, intelligent, efficient way, we do what's best for the patient.
Hurricane Sandy was unlike any catastrophe we've seen in the practice. We had to shut the entire building down, and obviously that was very impactful for us.
I think we were just opening up the Upper West Side office, so it was just 220 in Williamsburg. You know, that office just got completely wiped out. Like, we didn't know the status of it. We didn't know, like, if it would ever be up and running. Like, I just remember it was a crazy time for us.
Watching the community thrive, watching the neighborhood regrow was inspiring to us, and we had to come back. You know, there was an option to close this location permanently, but when we saw the community come back, we had to follow suit and show up, and are bigger now than we were before that storm.
Our offices are really state-of-the-art. The setup is great. We have brand new state-of-the-art lasers. We have phototherapy. We are all really blessed to be in an environment where the patient experience from a facility standpoint is top-notch.
Dr. Buka has a very forward-thinking way of practicing medicine. I think Dr. Buka loves those advanced, cutting-edge technologies and medicines and procedures that can make our day-to-day practice better.
Working alongside Dr. Buka and the rest of the providers has really embodied kind of a collaborative approach, and it's really kind of shown me the importance of teamwork, especially as I'm learning so much every day. It's important that everyone's kind of available for collaboration, which I really find is a super important theme of this practice.
I love working with my colleagues. Journal Club is really an intellectual adventure. It's so much fun. We present interesting cases. We work as a group and collaborate, and it's really like a little academic center. The learning and intellectual depth is really present at Buka Dermatology.
There are a lot of dermatology practices that are 1 or 2 doctors strong. I think because we have 8 to 10 MDs that are here at any one time, we almost operate like a mini dermatologic hospital where we can attract the best and the brightest dermatology residents out of training and make sure they have a huge breadth of experience, make sure they have every resource at their disposal. Getting that mix really makes us a thought leader in the industry because we've got the equipment and we've got the resources to combine with the best minds in the field to get the best outcomes.
The experience was absolutely amazing. Everyone was very experienced and sweet. I look forward to being assistant
What makes this practice different, everyone leans on each other. It just makes it awesome to come to work every day and have coworkers like the coworkers that we have here.
We all get along, and it's like we might not see each other in months, but as soon as we see each other, it's like we saw each other yesterday.
The doctors here, I haven't met a mean doctor here. The PAs, the NPs, they're awesome. Like, that's what makes this practice what it is. It's the providers, and also the staff is amazing. Like, have you met me?
We're very fortunate to have employees that leave a lot of their personal stuff at home when they come to work, and they focus on patients that they're often meeting for the very first time. We need our employees to show up 100% because that's the only way they can deliver the care and attention that that patient needs in that instant.
It's like no other office, I would say. I just feel like I'm not coming to work, I'm coming to be with friends and family.
So the patients that I see on a regular basis, they have to come like 2 or 3 times a week. I know some of them on first name basis. I memorize their birthdays just to check them in quicker and make it seem more comfortable for them.
Well, I was actually a receptionist here, and then I want to pursue a nursing career. They gave me the awesome opportunity in becoming a medical assistant here, and they taught me everything that I've learned. So that was a challenge for me, but it's just been awesome. Like, all the experiences, everything, the knowledge that I've gained. Just working here as a receptionist and looking at the things that I was exposed to day by day made me really want to do hands-on and become a medical assistant, and I love it.
Because I do see different things. Sometimes, things that are uncommon comes up and it's really exciting and you learn. I really, really love MA work. I really, really do.
I'm really proud of our staff. There's no way we could have done 11 years. It's not really about me. It's about this tremendous staff that we've assembled, right from our operators straight all the way through to our receptionists. 99.9% of them put their best foot forward every day and really come with their best sense of care and their best focus. I love them for that.